Hello friends, I am Dr. Yogen. Today I am here to discuss healthcare in India. It will be beneficial for doctors, public health specialists, and healthcare administrators to understand where lies the failure in our healthcare delivery system. Okay. It is a SWOT analysis of healthcare in India. SWOT stands for strengths, weaknesses, opportunities, and threat. Strengths and weaknesses will be discussed under two subtopics: public sector healthcare as well as private sector healthcare. And opportunities and threats will be discussed collectively. The strengths of public sector healthcare lies in its widespread presence across the country. It has much better outreach services. It is accessible, affordable, and more inclusive. Whereas the strength of private sector lies in availability of capital, resulting into technological advancement and quick services and sense of responsiveness among the employees of private sector healthcare. Weaknesses of public sector healthcare lies in bureaucratic and political interference, poor organizational setups, inadequate human resources, and corruption and lack of professionalism. Weaknesses of private sector healthcare lies in that they are profit driven, resulting into the high cost of services. There is always higher performance pressure on doctors just because they had to generate revenues for their um, bosses. And private sector healthcare is more concentrated in urban areas. So, considering private sector and public sector healthcare in India, we can say that the ideological approach adopted in public sector healthcare is more of socialistic, whereas in private sector it is capitalistic. So, considering that fact, where lies the opportunity of where is the opportunity for futures, especially for doctors? The opportunities doctors has to make their decision based on science, medical science. So opportunity is that our decision should be science driven. Okay, we are self employable. We should not worried about कि भाई हमको job मिलेगा कि नहीं मिलेगा. Opportunities lies in healthcare startups with more participatory and service oriented healthcare business models. Okay, this statement is very important. Healthcare startups with more participatory and service oriented healthcare business models. I mean to here, I simply mean to say that there should be healthcare business models which lies between socialistic as well as capitalistic approach, ideological approach, because earning money is also important, whereas serving people is also important. So one of such model is cooperative models. Another one is trust on hospitals. So this is the opportunity for doctors. We should get united and work on cooperative societies, which should be governed by doctors only. Okay, at affordable price, जो affordable price पे हम लोगों को services दे सकें. Where lies the threat in healthcare in India? There is always lack of capital. Especially in public sector, we are dependent upon many foundations or international agencies for their donations to run our national programs. Dependency on imports of medical equipments that results in higher cost of services. So हमको उस पर काम करना चाहिए. हमारे यहाँ रिसर्च एंड डेवलपमेंट हो, मैन्युफैक्चरिंग ऑफ मशीन्स, मेडिकल इक्विपमेंट्स हमारे यहाँ ज्यादा हो, ताकि हम कॉस्ट ऑफ सर्विस को घटा सकें. Another threat is inadequate continuous training of doctors, especially those who got into the services, especially medical officer cadre, because उनके लिए ट्रेनिंग के लिए कोई एडिक्वेट व्यवस्थाएं नहीं होती हैं, है लेकिन उतनी एडिक्वेट नहीं है. Mechanisms are always there, but those are not sufficient to meet their knowledge level. Okay, required knowledge level. And another threat is no dedicated medical service cadre that results in, because of that we are governed by, or doctors or healthcare workforce is governed by somebody who had no knowledge about, or a very little knowledge about healthcare or healthcare aspects, different aspect of health. So that's all for today. I hope you liked it.